From what you have seen so far, like the DG said, the premium set and the tariff for that is the amount the health insurance will pay the provider for providing certain services, including medication, laboratory, and others. I think they have been there for many years without being reviewed. And after, of course, we are aware of the inflation, the price of everything has really gone up. And again, probably as a survival mechanism for the provider themselves, they rather don't provide some services or don't give some medication because they are not there to run at a loss. So there is a big issue of the financing, the issue of a tariff, whether it's appropriate and what other view. I think that is very, very central. Apart from probably rare cases where the provider themselves want to game the system and not really provide the system. I don't think that's the really big problem. I think the big problem is the amount that is available to the providers to provide the needed services is grossly inadequate. And to solve that problem, and that's what DG have said, is that to scientifically determine how much, and based on evidence, what is the appropriate amount to give to the provider to pay for the service that reflects our economic situation. So like I said, the provider is not there to provide the service. But of course, there are other bigger problems apart from the issue of money not being available. There are issues with the quality of services at times. Of course, part of the problem with the quality of service is the availability of fund or lack of it. Part of what contributes to problem of service delivery or quality of service, having the human resources that is actually needed. All of us are aware of the Japa syndrome. It is very, very lucrative to move from this end of the world and other end. And these are the human beings that are supposed to be providing the services that are actually needed. There are a number of health facilities that some services they were able to provide before, they are not able to provide now because the manpower is not there, including both government facilities and private facilities. So that's that big issues as well. And I think there is issue of ability of the insurance agency, and I'm happy that DG is on board. He want to address that issue. Ability to timely get feedback from the patient that are assessing the services. That okay, what is your experience with that? Like he always say, health insurance is a product, and everybody that is producing things is interested in what the consumers are experiencing like this. So I think that institutional capacity, and I'm very happy he's looking at it, ability to from time to time find out from the enrollee what is your experience when we visited this facility. Did you get the services you are supposed to get? I hope you are not spending too much out of pocket, because the essence of health insurance is to ensure that we are not spending so much out of pocket. So of what you use, if I'm insured and I still spend exorbitantly, and the way of spending is that, oh, this commodity is not available, you have to go and buy it outside and everything. I think so we have to look at how to solve the issue of financing and strengthen the institutional capacity on the part of the insurance agency at the national and the state level, and work closely with the providers as well, so that they are doing their best, and then the HMOs, because they are very, very important factor. But again, in terms of a real thing that we need to do, because if you look at healthcare, somebody says, if you want to make a progress, go and look at somebody that has made that progress, try to study what they've done. So if you look at some countries in Nigeria, in Africa, in our own African context, how they've been able to make very good progress is like, in addition to maybe allocation, routine allocation from government, they've been able to find out what are the additional means of spending. If you look at Ghana, Ghana has been able to dedicate certain percentage of its value-added tax to paying for health insurance. And that is why Ghana has been able to cover up to 50% of the population or thereabout. So again, the NHIA is looking to that. There are a lot of analysis in terms of where could be the additional sources of funding that we can look into to mobilize. Because like the DG said earlier on, no matter what you do, even we say the premium is 5,000, many Nigerians are not able to afford it. So how do we pool resources together to be able to do that? I think that is going to be very, very central for the success of the new administration at the NHIA, which of course is a priority, because DG has told us time without a number. We had a meeting with him yesterday. That coverage is very, very key to him, to ensure that more Nigerians are covered. It's a bit shameful to say the giant of Nigeria is only 7% of
Giant of Africa.
Giant of Africa.